Howdy YouTube. This is 400 Pound Gorilla bringing you something a little different today. That is the view of day 12 post-op of right ring trigger finger surgery. There's still stitches in there. They're coming out tomorrow, and I guess I'm going to take you backwards from this through the surgery. So as you can see, a little bit messy there, but I'm hoping a lot of that clears up once the stitches come out. The neat thing is I can almost make a full fist, whereas before I could only get about that far with those last two fingers, and especially the right ring finger. But now I'm assuming as time goes by it'll continue to heal up. So good range of motion. Now my doctor would tell me keep the stitches covered, and I found using a fabric strong strip tended to be best over the last 10, 11 days or so. Actually, the first 4 days there's a different kind of dressing, and I'll get to that in a second. But even though that's the primary part where your hand moves, you can kind of see the crease in the bandage. It does keep that area protected with what they call a strong strip fabric bandage. Your mileage may vary, of course. Don't take medical advice from some doofus on the internet. Talk to your doctor. But this is my story of the trigger finger surgery and how things went for me. I didn't find a lot of information on YouTube about the post-op process. So here goes. On the day of surgery, I came out with a much different wrap. There was some surgical tape where that bandage is, and then there was some gauze. And I'm going to show you how the hand looked back then. This isn't wrapped nearly as well as the doctor had it wrapped, but for the purposes of YouTube, it was something along these lines. There was a piece of surgical tape over the stitches, then some gauze underneath that, and then an elastic bandage kind of wrapped her wrist to fingers, and he even sliced it a little bit that allowed him to put it through some of those fingers on top. Now, the process itself was interesting. The surgery was scheduled for 7 a.m. Hospital told me to be there at 5:30 to make sure, I guess, I could fill out paperwork, which really only took about 10 minutes. It was mainly arranging payment and insurance and things like that, and the rest of the time was waiting around. A few minutes before 7, they came and took me to the pre-op area where they asked me a slew of questions, and then told me that another nurse, the OR nurse, would be by in about 2 or 3 minutes to ask me the exact same slew of questions, which she did, and at least it was nice that they gave me the forewarning that I was going to get bombarded with the same questions again. I went with a local anesthetic, which means that I was awake for the procedure. After the series of questions and sort of the waiting around, the doctor showed up. It was good to see him, and he asked me how I was, and I told him I was fine, but the more important question was how was he? Did he get a good night's sleep? Did he feel like he was on top of his game? That got a smile out of him, and he was ready to go. He did initial my right ring finger, which gave me a good feeling of comfort that they weren't going to operate on the wrong finger, and asked me a few other questions, and then he said he would be, see me in the OR. A little while later, they wheeled me into the OR and began to put a surgical drape across, put my arm through a surgical drape and position the table and the lights and everything else. Then the doctor came in, Gave me the, I think it was lidocaine or whatever the locals are. That's the most painful part of it. You feel the shot itself and maybe some burning for just a few seconds. And then your hand goes pretty well numb. Like I said, I stayed awake. Probably it took 10 minutes or so while they were getting me set up for the surgery. And then once they actually started performing the surgery, I can't imagine it was much more than about 10 or 15 minutes. And, you feel pressure. He asks you to make a fist, and then he asks you just to move the finger that's being operated on. I watched plenty of the YouTube videos on the actual surgery, so that's part of the procedure. And then he was finished. They wheeled me out shortly after to a recovery area. Since it was only a local, I didn't have to spend more than about 10 or 15 minutes, maybe 20 minutes there. My wife had come with me to drive just in case. They said in case it was necessary to go with more than a local. And probably by 7:30, 7:40, we were done at the hospital. I was dressed and we were back on our way to the car. Now the hand was completely numb and stayed that way most of the day of the operation itself. We'll call that day 0. And the instructions were to keep it elevated, sit on the couch, put 4 or 5 pillows under it, keep it above the heart, and keep it dry. And don't remove the wrapping for about till post-op day 4, with the day of the operation being 0. Ask about when the local wore off, would there be some pain? And he said there might be, but it would, ibuprofen was the thing they recommended. So on the way home, we stopped and got some ibuprofen. And essentially that entire day it remained numb. I had it elevated, sat on the couch watching TV, pretty much what you would expect. Didn't feel like doing a lot. And what I was most nervous about was he had told me in the process that once they cut through the sheath, that I would feel an immediate release. Well, with all the bandaging and everything else and the numbness, I could move my fingers a little, but not much more than I could before. The other thing he said was, your hand has a natural tendency when it's relaxed to curve. He wanted me to make sure every so often I did straighten it all the way out, or as best I could, to keep the flexibility in the hand. For those of you that like looking at the actual stitches, I'll try to get it there. But that was how I spent day 1, and pretty much day 2 and day 3 we're sitting on the couch. Now they tell you don't use it, don't put pressure on it, and all that kind of stuff. And like an idiot, by day 3 I was feeling pretty comfortable, and I was eating lunch. And when I got done, I went to lift myself up from the table and push down with the hand, and I felt a sharp pain. I was worried I had busted a stitch, but that was not the case. Everything seems to be fine. We're, like I said, on post-op day 12 now, and like I said, I have a pretty, feel pretty good flexibility in it. There's no pain. I mean, there's a little tightness, I guess, in the hand where the stitches are. I'm sure once they come out, that'll go away, or I'm hoping it does. And I will tell you that that first week or so I was nervous because there's some, I'm assuming, swelling plus the bandages, and you're a little tentative to use it. But at about the 7, 8, 9 day mark, it started loosening up and becoming much more flexible, and I had a much more feeling that as time went by it was going to continue to heal and allow me to bend it. So I became very happy. Tomorrow I get the stitches out, and I will say I'll post an update, but probably not. So for those of you who are facing this surgery that are wondering about the post-op, that's my story. Your mileage may vary, but I've been very happy so far with everything. And I hope if you're facing this will relieve some of the anxiety or stress, or give you an idea of what to expect in your journey. This is the 400-pound gorilla out.